Hi, good morning, good afternoon, all. Jodie Baker Calamai. I'm a partner in our HR transformation practice focusing on HR advisory, helping organizations in Canada, North America, and globally on their HR transformation journeys, setting up shared services, developing business partner models, reconfiguring COE organizations, and spent a lot of time in the healthcare space across Canada, actually. Literally coast to coast, from Eastern Health in St. John's, Newfoundland, all the way to Alberta Health Services in the province of Alberta. And previous to that, was living in the UK, working quite a bit with the AHS on their small steps in their HR transformation journey. Looking forward to helping you all in a similar capacity. So Alberta Health Services was formed in 2009 when 12 local health authorities came together to form one provincial healthcare organization, which formed to be over 90,000 employees across the province of Alberta. And when we went into work with them, what we found up front was, but like you'd expect, 12 local health authorities equals 12 different ways of doing things, a number of different cultures and ways of working and ways of viewing where they worked, hugely manual processes, disparate technologies, and in many cases Excel spreadsheets instead of real HR technology. It was a heavily unionized environment with a couple different big unions, and overall different way of philosophy of delivering HR. So what we did was we took a step back and said, based on this current state, what's the right HR service delivery model and enabling technology moving forward? And really involved a number of different stakeholders across the legacy health authorities to actually create what the future would look like. So one shared service organization, actually located in 3 different locations, with COEs and business partner roles scattered across the province. The shared service organization was, as I mentioned, 3 sites. So 2 strategic locations across Alberta where they knew bulk of their HR employees were located in the current state, and then a 3rd outsourced location providing service to the broader population. So our first big lessons learned was really around looking around the corners and designing a model that worked in the current state but also took into account the future. And that was really evident in the design of the shared services organization. So we did 2 things. One is we took advantage of an outsourced third party that was already in place delivering in Calgary, one of the legacy health regions. And we leveraged that for the broader part of the province. And why we took advantage of that was we said, this works today, let's not break it. But by having a consolidated contact center that was outsourced gave us the launch off point for the future when we wanted to potentially bring that in-house to say, let's get the service standardized and create a model that could work in the future in a different way. And that manifests itself in a number of different areas as well. So I mentioned there was 3 components of the shared service organization that we created. In some areas, we weren't actually able to move staff into those locations because there was a number of rural components of HR that we just didn't want to break the connection to. But they reported into these 3 components of the shared service organization. We knew over time that as those people sitting in those local locations would leave, we would replace them with people who sat centrally. That was part of our philosophy of designing a very clean, consistent model, but recognizing that given the fact that it was public sector and an important employer across the region, we knew we didn't want to break something that was working and upset the unions at the offset. Our second lesson learned is around the fact that a simple service delivery model can support a complex organization. And this was the mantra of what we did at Alberta Health. So the reality was 90,000 employees, 12 different legacy health authorities, 12 different ways of doing things. A lot of complexity built into the current state. But what we anchored people on was a vision for how HR could be delivered very clearly. One center of expertise, community of expertise that was focused on leading practices, design of policies, sensing of what was happening in the health sector in Canada and globally. One business partner group who was focused on partnering with, heads of hospital, leaders across all the wards and groups within the hospitals to make sure they had the right talent in the right roles, delivering on their vision. And one shared services or operational services group that was focused on, inquiry-based support, transactions, consistent service delivery, consistent delivery of technology and tools to all 90,000 employees. So again, complexity around 90,000 employees, 12 different ways of doing things, but really 3 groups with discrete mandates and focus to deliver high-impact HR. Our third lesson learned was really around assessing and understanding the environment in which you're operating in. So absolutely, Deloitte came in and partnered with the AHS leadership team on a model, a framework, a perspective of what works in the market in delivering high-impact, effective, and yet efficient HR services. But we took into account a number of factors that were unique to Alberta Health Services. So again, 2009 merger, a number of different leaders, a number of different perspectives, a lot of stakeholder engagement that needed to happen. So a huge part of our approach was just bringing people on the journey, gaining buy-in to this new way of operating, knowing that it was very different to how they operated previously, and in the context of a massive merger, which changed the culture and perspective of the environment to which they were delivering their service. The other factor was the previous divide of urban and rural support. So there was legacy perspectives on what are the needs of constituents and employees in an urban environment versus a rural environment. So really taking that into our storytelling around what the future state HR organization needed to look like was really important to make sure both the HR teams in rural areas and urban areas understood what this meant for them and how it could actually change the dynamic in the way in which they were supporting their employees, managers, applicants, pensioners across their parts of the organization. And the other thing was recognizing the union. So different to some of our HR transformation efforts, we had a huge role to play in partnering with the union early on to bring them on the journey, understand what the new service would look like and why it actually would improve the career pathing and the service delivery opportunities for their unionized HR employees as part of this. So, really taking a step back and saying what's unique about this organizational context in which we're operating with, and how do we tweak, pivot, build into our approach the fact that we need to behave and engage in a different way. And that was absolutely what we did in the case of Alberta Health.